Okay, I am here today in Tübingen, Germany, working with the world's best biohacking dentist, a good friend of the videographer right now, who's on my team, Victor, and I'm so glad that he introduced us. And I have a number of root canals, old cavities, that have been filled, and I am interested in resolving this. Literally, he uses the best bonders, fillers, red light, ozone. I'm just excited to get this full experience and to learn a lot more. I know that this stuff can be very dangerous with the way current dentistry works, that there can be bacteria that's left in there can be spaces left in there, it can be necrotic and affect these nerves that go straight to the brain, straight to the spinal cord, that this bacteria can get into your bloodstream and literally be slowly or even quickly killing you over time, leading to greater strokes, heart attacks, Alzheimer's. So I really am excited to get this resolved. I just turned 50, as you guys may know, and my health is great across the board. I've done brain scans as I've had a former brain tumor. I've looked at my heart, I've looked at my lungs, I've looked at my blood work, my epigenetics, my gut microbiome, all this past year. Everything's looking great. I'm aging at 0.7 to 0.75 over the last year or so. So that's looking great. I'm literally aging much slower than my chronological age. The one thing that I want to have resolved is this. So I'm excited to look into this and chronicle this journey so that you can learn more. Let's go.
Hello, good morning, Sean. Hi,
Hello.
I'm Dr. Tanya. Hi,
Hi.
Nice to meet you.
Nice to meet you.
So what we're going to do today is actually examine your teeth first. I'm going to take a look at your teeth, at your gum, and then we're doing some photo shooting. Yeah?
Okay.
And then also we're taking some impression of your upper and lower jaw. Yeah. And then we will discuss about your cone beam and about the panoramic X-ray.
Okay.
Yeah? What I can see and so on. Yeah?
Okay.
And then we'll also discuss about the surgery, and if you have any questions, just let me know.
So what does that mean once it's in the bone? Like, what's the result of that?
Inflammations.
Okay.
Because your root filling is not supposed to be found in
The bone.
the bone.
Mm-hmm.
Your body knows better actually.
Yeah.
That's why it builds inflammations to let us know actually there's something wrong. Like the inflammations with your sinus, it's actually a sign. There must be something wrong. That's it.
Okay.
Do
Hey.
What's up?
I'm getting all the bad news.
I
But-
thought it's good news.
Well,
It's about optimizing your health, right?
it'll be good, I guess, when it's done. This, we're talking about how long it'll take to feel pain, and then how long to heal, and it's 4 months to heal, and
Yeah, I think 3 to 4 months. But that's not the pain time.
yeah,
Not the pain.
yes,
Yeah.
Big cavitations, man.
yeah,
They showed you, right?
Yeah.
That's good. I mean, now you know.
yeah.
Like, this is the perfect spot for viruses, parasites, infections, even heavy metals. All the stuff gets stored in there. So, and lots of root canals. This is what I always feel like. This is foundational work, and especially in the biohacker world, you miss this.
I know,
It's kind of like it's not part of the body,
right,
and you're just compensating for it.
right,
And if you know that there's studies showing that, for example, these endotoxins from the root canals can cause low quality of life, even depression, anxiety. I think it should be at least informed consent, right?
right,
Right? That's why you do this, and then this is your health journey. There's not like a acute inflammation. The problem is always chronic inflammation. So you see this little bit of inflammation here, like this is your sinus, should be black. And then you see this tiny little bit of gray.
Yeah,
Just
it's the
the sinus
inflammation.
membrane is chronically inflamed. protecting. Some people have huge cysts, you don't have that on this side. And you would never catch this on a two-dimensional one. And usually the conventional dentist root canal is a standard treatment. Because obviously you can totally bite on these teeth. That's the problem. It's all about biting, smiles. You can cover it with nice crowns. Okay, let me see that front tooth. There's two mechanisms, either cyst to protect or wall, basically building more outside body. It's basically protecting. And then the titanium implant, yeah, there's no bone here, basically.
Yeah.
So the simplest options would be if I can take this out and get bone here to more like above and put the implant there and then just build a bit of bone simultaneously. Because if we can't do this...
I've gone to other dentists and they've told me, like even aesthetic dentists, they're like, we don't want to touch this.
This is a prosthesis, right? An implant is a prosthesis, and actually it's an exoprosthesis because the gum is the opening to the outside world. And the ceramic one has this one, the most important thing about the ceramic one is that it's a biomaterial, it's neutral, and the gum basically closes it. So it's actually really tight. Versus titanium is always opening. So yeah, let's just see. In this case, the main thing is getting it out and then seeing what we can do. So that's what we're going to do tomorrow, right? Did you take enough vitamin D3? Like I said, and good protein, good food. And then we do everything over there, hyperbaric. We will scan your whole body. Then IV, obviously, today, tomorrow, all the things we need to just help your body heal.
It's a little stressful. It's a lot more than I thought. But it's also because it's a lot worse than I thought. Basically, any root canal is a bad root canal. That the material that they use to fill the root seems like it often ends up in the bone matrix, causing all kinds of inflammation. All the areas that my wisdom teeth have been pulled at the back of my skull and jaw are a massive amount of inflammation. So every root canal I've had and the wisdom teeth being extracted is massively inflamed. And this is leading to toxicity. This is directly going to my brain, to my bloodstream. This is systemic inflammation. This is brain fog. Every time I've had a root canal, it wasn't just dental pain. It was extreme inflammation, confusion, brain fog. And one of the times, about a year ago, I nearly died. It was septic, meaning that the toxicity was in my bloodstream. It had gotten so bad. And they told me that I nearly died. And it was extreme confusion. My heart rate was 2x, my blood pressure was 2x, and I truly felt confused and like I was dying. And I've been dealing with like, not just brain fog, but memory issues. And so I wouldn't say excited about all this stuff that I'm having done, but I am very interested to see how I feel on the other side of this. This is, I think, one of the most underappreciated areas in health that many people are silently dying from, is these root canals, these wisdom teeth extractions, cavities, that are just not being appreciated in terms of their impact in your health. I think much like sleep is underappreciated and probably the most important factor in your health and longevity, I would say this is right there with it. And what's tough is people are scared of dentists. It's painful. It's embarrassing. It feels embarrassing right now that I've had all these issues. But I do want to talk about it. I do want to be vulnerable about it. I want to help people make impact so that people don't go through what I'm going through, or worse, even die from these things just because it has some pain or some embarrassment associated with it. What he's doing here is a whole other level with PRP, with hyperbarics, with ozone, with ultrasound, with these ceramic implants. And while it's going to be a long time, 4 months for me to truly heal up before I can even get the temporaries, which is a long time, this is going to be worth it because this is the rest of my life and it's the quality of my life. So I am interested to get all this done, and of course I'm going to keep everyone abreast of everything happening. So thank you for following along.
So that's basically the Optimal Health Lounge, where we like have all, let's say, the biohacking and things. The idea is always, as you know, we have to be resilient. So sympathetic and parasympathetic need to work hand in hand. But what it tells you is like your senses basically are a little bit blocked. So you have a lot of energy. See, there's not an energy deficiency. The problem is more like, you see, these lines should basically touch the blue one. But for you, you have a couple of blocks. See, these three are blocked. Your immune system, your nervous system, your hormone system are blocked. They're not working functionally because of your senses. And you have a lot of energy that your body is needing to compensate for that. Actually better than the other way around. So you have energy, just have to balance it out. Yeah, your cells are not perfectly communicating. Those are basically, it's nitrosative stress, it's oxidative stress. You're compensating that quite well, but it's a lot. So because mainly all that toxins are probably in your interstitium, you know, in between the cells. So the in-body basically tells me your musculature, your body fat, also your visceral fat, basically the fat around your organs, as well as how healthy is your cell. It's actually quite good. And how much you drank, and your muscle distribution, because it scans each limb separately, and then the torso. This is all separate. 24% body fat, I want to reduce this to 12. So if you do the protocol, starting with the surgery, that probably has lots of these toxins that lead to inflammation and fat gain. So if your body has a lot of toxins stored, it doesn't want to get rid of it because you have the root sources still in your mouth. And I think we measured it right now, there's a lot of toxins going on. So if we get rid of the source, your body instantly will release it. Yeah? But you have to pull the plug, which is, for example, the root canal, the titanium implant, all these different things. And then all the diet things you're doing will finally work again. I know you're a big fan of keto. Do you still do that? Because I wouldn't do it right now, actually.
At times.
At times,
okay. At times, not currently, no.
Okay, currently, I'll tell you exactly later.
I'm doing lower carb,
that's
high
good.
protein.
Yeah, that's good.
But not keto.
That's good. That's a good one. We discuss it in a minute. So because we want to have your visceral body fat, I want to have it as low as possible, obviously, because that's always metabolic health issues. I mean, you have good muscle, you could always have more muscle. I don't think that's a problem if you have 5 kilos more. But we reduce your body fat, just half it would be ideal. Then also, obviously, you're less insulin resistant, your hormones work better.
So over the last year, I used to work out 6 times a week. Over the last year, I had stopped because I was actually like blacking out in the gym. I was
fatigue,
not like blood sugar and blood pressure. I was getting all these issues, and that led to, this is right before I was turning 50, to me like doing all kinds of tests, like looking at my heart, looking at my brain. I've had brain tumors. I had very high blood pressure. I figured out that I was on a sleep medication that actually was making me hypertensive. As soon as I stopped the sleep medication, the hypertension went away.
Which medication was that?
I had like 180 over like 130.
Oh wow, that's high.
As soon as I stopped, like the day after I stopped, I was like I was 115 over 70. It's crazy.
That's really crazy.
This is Lunesta. It's similar to like Ambien, like
these
kind of drugs. Maybe it was causing apnea. I'm not sure, but.
So you figured that out?
Yeah. I figured that out, and then I've been doing all kinds of blood work and tests, and one good thing is I'm seeing like everything is good. My heart's good, my brain's good.
I always ask 3 questions. Do you have any metal in your mouth? Stand up. Any root canals? Stand up. And wisdom teeth pulled.
and you have an answer yes to everything.
I've literally been to a dentist probably more than 200 times in my life.
That's insane.
And so now, like even when I have psychedelic journeys and things like that, and I have, like it makes me want to cry. Like I have trauma around this.
Yeah, we will release it tomorrow. Trauma, yeah, teeth are kind of like, I always say it's kind of like an external hard drive.
Yeah.
They are like crystals, right?
Yeah.
You know how hard drives works. It's basically, I don't know the English word, but it's basically crystal structures. And they store all the trauma too. So every single dead tooth or that titanium implant has that stored energy. So it's always remembering you of the past. It's all past stuff, it's dead stuff. That's why we take it out. Then you maybe cry tomorrow too, because you go instantly, you're a bit sympathetic right now. So maybe you go into parasympathetic, but it's good. So this is a safe space. So whatever comes out, you just let it go, because that's why I don't do full anesthesias. I want you to heal, because I'm only helping your body heal. And your body can then do this, and obviously then afterwards, to ossify everything, it takes about 3 to 4 months, but you will still have teeth. Like, it's not that you have a flipper. I hope this is stuff from the past. But I can see that this is major trauma. And the problem with the veneers is a question I get a lot on socials. Are you okay with veneers? I'm actually totally okay with real veneers. But most dentists don't do veneers. That's what you have is caps. Those are crowns.
Yeah.
A veneer is actually an additional work. Like you said, it's like a fingernail. And a real good veneer, even non-prep veneers, they're sometimes 0.1 millimeter, like really tiny.
That's what I thought I was doing. And they never told me that.
But you did that in the US, not in Turkey.
Yes, in the US.
Okay.
And so I thought I was getting what you're saying. Like, that's how I imagined it in my head.
Yeah.
And then when they show me in the mirror, like, what happened,
They just prepped
it
it.
took my breath away. I'm like, I already had fear of how my smile looked, and then to see like
These tiny teeth.
jagged small teeth, and they shaved away everything.
Yeah. This is why we're careful. So in your case, it's like this ship has sailed, but ideally what we do is we work with dental designers. Those are lab technicians that are kind of like artists. And we scan your whole face and the mouth and everything before we even do anything, plan it digitally. It's called digital smile design. And then we know, okay, there is maybe a tooth that needs a cap, but most of it is additional work. So we can see, there's a little bit missing here, there's a bit missing there. So we can, the technician knows exactly how much we need to take away as a dentist and prep. But there's a lot of work up front. It's kind of like backward planning of a house. That's how it should be. But this is the norm. Unfortunately, what you have is just more the norm. Because it shaves it down. If you shave it down too much, then you open dentin, then you get pain, then they do a root canal. That's just the normal way. But the main thing for us is always, how can I optimize your health or help your body heal? So the Biodentistry 3.0 concept is the fusion of that high-tech dentistry work, using only biomaterials, but with functional medicine, biohacking, health optimization, whatever you want to call it, to help that complete body. Because I'm not healing you. I'm just helping your body heal itself. It can. As soon as we take out the root sources, it can.
Like a lot of times doctors talk about like, take this pill and this will fix you, or the doctor saved your life. This is like literally stealing someone's autonomy. The idea is that I'm facilitating you healing yourself.
Exactly.
And it may sound like a small difference, but it's such a huge difference to tell someone that they have the ability to heal themselves, that they're not broken and they're not dependent on another doctor, on a medical system, on a pill.
No.
Those things can help you facilitate your own health.
Completely correct. And there's always 5 levels of healing. It's kind of like a pyramid. So this is your physiological body, where we do the surgeries, where we give you new teeth, where we take out all the stuff. But then there's the energy level, mental level, spiritual level, all these different areas, but they're all connected. So some people try from the top down, only spiritual side of things, but the body is still unhealthy and full of toxins. It's hard to get connection if you have tons of metals in your mouth, which is like a big antenna, or toxins. And your body is always in a blocked state. So we're always talking about epigenetics. And chronic stress is the main trigger for chronic inflammation, for chronic stress, for chronic epidemic of the 21st century is chronic disease. And there's only one thing that you actually cannot biohack yourself away. This is actually dental repair because you cannot take out the root canal. It's just not possible. And to get this into the mindset of the dentist to understand, hey, wow, biodentistry is just the next level. It's just the evolution. It's not even against conventional dentistry. It's just finally upgrading this bit because we want to help patients heal. One of the main things that I teach is thinking in nutrients. This is the food design concept. Why do I do this? Because I have so many patients. Some of them are vegans, some of them are carnivores, some are in between. So I wanted to have an umbrella that teaches that works for everyone. So I don't have to change your mindset. Luckily, he and me, we eat the same stuff, so we can eat animal proteins. So super simple is the red chart is what he shouldn't eat. Basically all pro-inflammatory foods, gluten-containing grains, sugar, bad oils, seed oils, and also conventional dairy I would avoid right now. Raw maybe, but only 2 weeks after surgery, if everything is clean, because dairy bacteria like to eat that too. And it sticks very nice into open wounds. So no dairy right now. But you can do that in 2 weeks' time. Raw, it's probably not a problem, right? And then we have the green chart, which is protein, so macronutrients, protein, carbohydrates, fats. So 200 grams of protein a day, and then I would say 50 to 100 grams of carbs in the evening mainly, fruit, your berries in morning and lunch, and then dinner is, let's say, 1 sweet potato or a cupful of rice or cook weight. And obviously you can have your green leafy vegetables if you like them, if you like the fiber stuff. I wouldn't go high, actually right now, I wouldn't go high on any fat stuff. So I would keep it lean with the proteins, like 2 eggs maybe, not 6, just to get your body fat burned off. And then later you can maybe increase it. So let's say a gram per, what would be gram per kilogram would be half a gram per pound, let's say 100 grams of fats. I think that's fine. It's obviously a caloric deficit, but you have a lot of stuff we can work with. And that will help your healing process, gets you more insulin sensitive, help with your hormones and everything, and just we're optimizing yourself. So that's why nutrition is so important. And the bone healing phase, systemic bone healing, is also crucial that we use the right micronutrients. You know, vitamin D3 is high. We do 20,000 IUs a day for the next 6 weeks, including the K2. And I give you the bone and tea supplement, you will love that. Okay. There's boron in it, activated B6 for all the cryptopyrrolurias. And just to make sure that you're systemically building bone, which takes about 2 to 4 months to fully heal. It's kind of like building a new house. We don't want to have like a construction site stop. It's really bad then because it doesn't start again. Right now, if we have the surgery, we have an acute stuff. It's anyways going, so if you keep it, that's why I want you to be anabolic, don't fast, 12-hour feeding window.
Collagen and creatine.
Collagen is in the supplement protocol. We have a lot of creatine in it, and we do about 10 to 30 grams of collagen on top.
I don't know that a lot of people know that creatine can help with bone as well.
With bone, yeah, and also actually we need a tiny little bit of insulin for that bone. That's why we have these carbs in the evening. It's also important for osteoblasts to build the bone. Yeah, so it's cool. And if you experience tomorrow what we're doing, you will tell me after. I will give you my nurses will give you the instructions to don't focus on the mouth, because we're not working on symptoms tomorrow. We're working on root sources. So you focus on everything else by just focusing on your breathing, box breathing, for example, and let me do my thing. And then feel your whole body from here to your foot, because it's all a fascial system. Yeah. So this fascia from here goes till your right toe, and from here to your left toe. So you can feel all in between. For example, that you can suddenly breathe deeper, or your neck is moving better, or you see clearer, or you have different thoughts, or you're less depressed but more happy. Stuff like this. And this is what is fulfilling to me. If you tell me, wow, I had this and this problem, but now I feel this and this better, and I also have nice teeth. That's the focus, not only the aesthetics. It's health and aesthetics, right?
That's the DNA way.
That's the DNA way, health and aesthetics. Here, that's the DNA.
Today is the big day. What makes things different here? This isn't just a dental procedure as you're learning. Again, he doesn't do root canals. He does ceramic implants. He's going into these spaces that are where my wisdom teeth were extracted, where all 4 of them have inflammation and infection for the last 34 years. Along with this, when he does his procedures, you have multiple days of hyperbaric chamber to oxygenate tissues, to literally speed up healing. We also do multiple IVs, like IV vitamin C. We're doing red light, ultrasound, ozone during the therapy to heal the areas. So, I mean, everything is just well thought out here and completely different from a traditional dentist in the United States in particular. So this is quite exciting. They also do what's called PRF with this bone mineral matrix, which is similar to PRP, where they take your blood and spin it up. And that's actually what they're putting into these areas as well during the procedure. So, I mean, everything is as well thought out as possible. He has a complete nutrition plan, supplementation around this, his own supplements that are extremely clean, that I find very impressive. So, just highly impressed with everything here. And here we go. It's going to be 5 hours in the surgery/procedure. I've spent the majority of my life embarrassed about my teeth, my smile. This is a very emotional day, but I am excited for what happens on the other end of this. As I understand it, the root canal material is in my sinuses on the majority of them and causing inflammation, as well as potential infection. These spaces where the wisdom teeth were extracted, not only potentially have bacteria, but mold and parasites and other horrible material. These nerves go straight to your brain. These infections go straight to your blood. The reality of this is I know like the risk for Alzheimer's, dementia, for stroke, for heart attack are all dramatically higher. I have been experiencing brain fog and memory loss over the last 5 years or so. Pretty severe. And I'm doing all the things right. My health is good. And I think this has a lot to do with it because a number of these root canals have taken place over that time. And a year ago, I had to have a root canal and it went septic and I nearly died. And I was very confused and had extreme memory loss. And so this dental situation has just been a massive source of trauma, and I need some spiritual, mental, and physical healing around it. And I'm glad I'm here. I'm glad that I'm in such capable hands. I'm very fucking angry about the things I've found out, that I could have done veneers that truly were like paper thin without shaving down my teeth down to the dentin, down to the nerves. I could have had ceramic implants instead of metal ones that transmit heat and EMF directly into my sinuses and my brain. I could have had ceramic implants instead of root canals that are massive sources of toxicity. But I wasn't told about any of this. I had no sovereignty in any of it, which is very sad. And they're still telling us to use mouthwash, which is killing nitric oxide, which is killing us. They're still telling us to use fluoride, which is killing us and calcifying the pineal gland and so many other things. And this is all very frustrating. Not just frustrating, like anger-inducing, that I've been manipulated and used and my health has been put in jeopardy. And so I'm taking that power back today. Well, now they're going to take my blood so they can make this PRF that they can use during the procedure, which is similar to PRP. And I'm going to have 5 ceramic implants put in, as well as clean out my wisdom teeth extraction areas times 4. So it's going to be a full day, about 5 hours. There's no anesthetic.
Good morning. Hi. How are you, Sean?
Wonderful, wonderful. Yeah,
okay,
how are you?
So now I'm going to take you to the other room
Okay.
to draw blood
Okay.
for the plasma membranes.
Yep. As I've said, I do heroin every day. So this is very easy for me.
Oh my. So you know what we're going to do with the plasma membranes?
Yes, you're going to put it into the areas you're doing all the
Yeah,
procedures
perfect.
on. Yeah.
Because they contain like growth factors, stem cells, and they build bone again there. For the wound healing is also perfect.
Mm-hmm.
Dann direkt umstecken in den nächsten 14er Abteil. Ja. Enjoy.
That makes you happy.
Got some protein?
Yeah.
That'll be the best part of the next 5 hours. Hey, brother.
Yeah, I said you were curious too. I just told him to put it on airplane because we're trying to be EMF free as much as possible.
Yeah.
I know it's not 100% possible, but we even have an EMF blocker. Obviously everything is grounded, even my shoes. So yeah, we'll take care of everything. But as long as he has still metal in the mouth, it's still a walking antenna.
How's it going, buddy? What's up? I'm a little bit numb. I'm
All
trying
the
to talk
guys
to you.
here.
I'm trying to talk and I'm a little bit.
You're
gonna start
completely
dribbling
numb-
all over you,
completely
mate.
numbed
yeah,
up.
I am.
Yeah.
I am.
He's there already for
You
second
haven't
stage.
started yet, have you? No. It's easy. It's a walk in the park. You're
You
in
even
hands.
had a nap detected while we did it.
Yeah, I napped last time.
While
Yeah.
taking out titanium implants.
Yeah, we had titanium implants taken out, had the gold tooth taken out.
But I remember that when we did
3
that titanium, you had like a deep sleep phase or
Yeah, I
something.
know. I know. And
great.
3 root canals, wasn't it, taken out as well?
No more. One,
More,
two,
was it?
3, 4, and the titanium 4.
I had a lot of work done.
Five.
And like I
Same
had,
with me.
I had 0 swelling. All right, we'll get into it, brother.
right,
Good to see you.
Yeah, good to see you.
All right, my man. I'll see
Later,
you in
bro.
a bit. All right.
Yeah.
Good vibes.
Okay, Sean, let me see.
Yeah.
We just finished his first part of the surgery. We decided to only do upper jaw, which is actually, I would say, 80% already. So we took out lots of dead particles from him, like dead teeth. That's all his dead tooth battery. Lots of inflamed bone, titanium implant, gold crown, different material.
It's been a long day. It was about 8 hours that I've been here, and there's a lot of, as I've talked about, trauma in my life around veneers that shaved down 80% of my tooth. Even as a child, losing my front tooth and having a plastic cap that was a different color, a different shape, and I got made fun of for it. I've never loved my smile. I've had, obviously, many root canals, and I don't know why that is. Maybe it is because of the titanium, different materials they've used, maybe because I used to use fluoride all the time, and just the wrong things. Everything I've learned was wrong. And there's nothing more intensely personal and embarrassing than needing dental work or having an imperfect smile. I know, like, and then add to it like pain and fear around visiting the dentist. There's a lot like that's emotional and spiritual here that I need to work through and process. And just looking at, this is the dead stuff that was inside me. And by the way, I'm talking with a little bit of a lisp because I have a splint across here. It'll be optimized in the next few days, but this was all inside me. Titanium and gold, which apparently Dom is telling me creates a battery in your mouth. Literally a conductor in your brain. And then all of the filler material that was used for these root canals was pressed and up in the sinuses, causing inflammation. It was well beyond where it should have been. So obviously I'm interested to see where I go from here, if I feel a lot better from here. But knowing how toxic all of these things are, I just find it disgusting that I'm here, that I had to do this. But obviously I'm very glad that Dr. Domi did so much work today, an incredible amount of work in a timely fashion. And I didn't even need anesthetic. I didn't have nitrous. I didn't have anesthesia. I was not knocked out. I wasn't dissociated. I was present for all of it. And this is something that he wants. He wants to see like what you feel, what you experience as he goes tooth by tooth, area by area. And but he makes it painless. I would say about 95% of this, I felt nothing. He did use local anesthetic. I did have some Novocaine IV, but all in all, even though it was long and it was emotionally difficult, I felt very little pain. And so I'm happy that this stuff is out of me, and of course I'll be very happy in 4 to 6 months when I get the permanence done. But I'm excited where we go from here. I feel a little raw in my mouth. I have stitches. I have sites that are healing. I have essentially a splint across these 4 teeth. So I'm talking with a little bit of a lisp. He's going to fit that even further once it kind of settles in over the next 24 hours. But pain-wise, I'm in a pretty good place. Like, it's a little sensitive, but considering that I had bone gum built up here, I had titanium screws removed from my head. I have 3 left today. That should take about 2 hours. On the lower, I have 1 root canal spot, and then 2 cavitations again from where my wisdom teeth were excised. And so cleaning all that out, and then it's just the healing over the next 4 to 6 months, where bone will grow back in these spaces. The irritation, the inflammation of the filling material that they used to do the root canals with is now gone. The toxins, mold, viruses, like literally all of this stuff that could have been there, parasites, is removed through ultrasound, ozone, all these different techniques that he's using. And then it gets replaced with this PRF material that's similar to PRP. It's a lot more viscous, and it fills in those spaces to, 1, help with healing, but 2, help with filling in gum and bone where it needs to be, and protecting those sinuses. Like when he was showing me on these videos and the cone beams, there's all kinds of stuff that's in my sinus spaces that should not be there. Again, with this root canal filling material, but also just years of inflammation And then on top of that, again, like collected amounts of all these other bugs, essentially. So I'm excited to know how I'm going to feel with all of that removed, all that inflammation removed, parasites, mold, bacteria, viruses removed, and then bone replacing it. Just have a healthier body. Not just, we think of this as a mouth, but all of this is impacting all my nerves going to my brain. This is impacting my blood supply going to my body. Dom likes to talk about a lot of these meridians that affect all the different organ systems of the body. So there's a lot going on here. I mean, this implication is a lot. He also talked about leaky gum leading to leaky brain and leaky gut. And about 50% of the microbiome in your gut is supplied from your mouth. So he says that basically, if your gut is dysbiotic and on fire, every time you're swallowing, you're just adding gasoline. It's not going to get better until you get your mouth healthy, because more than half of what's being supplied here is from here. So that's a profound thought too. Another thing that he mentioned was that I had a gold crown and a titanium post, and that essentially was creating a battery in my mouth with the ions. So these things are like kind of mind-blowing to me, what I had going on. He also told me that EMF can heat up this titanium post that was going straight up to my brain. So this thing is literally heating up with EMF and essentially is a conductor into my brain. And these are things we don't get told about. So I'm feeling good, feeling like I'm taking steps forward to my recovery journey. So I'm very happy that it started here. So today I'm in the recovery space here of the lounge. I'll be doing the IV that has a little bit of antibiotic, as well as 15 grams IV vitamin C, a little bit of painkiller. I'll be doing the hyperbaric chamber, and I'll be doing the last 2 hours of what's been probably 8 or 9 hours of total procedure time on my lower mouth with Dr. Dom. So we're doing 1 root canal and then 2 cavitations where wisdom teeth were extracted, and then some more healing with probably another round of hyperbaric, and then just some rest at home. So that's the plan. I'm here with Dr. Domi here at the DNA clinic. I have had, there's 5 root canals, 4 wisdom tooth extractions that are cavitations, and then this front titanium implant. So a lot of work being done, and I've been experiencing his work. This is me the next day, by the way, and I have very little pain, some inflammation, but he built up gum and bone here. And I have ceramic implants replacing the root canals, and been doing the treatment over at the lounge with hyperbaric and IV. So this is like a very holistic protocol.
Because the goal is to help him heal optimally and do the surgery as minimal invasive as possible. You can see it, like we did remove 3 molars, 1 front tooth, and 1 titanium implant that was really chronically inflamed, and placed ceramic implants, everything you just said, and he doesn't have any swelling at all. That's because of the whole thing we're doing, just helping his body heal optimally. We're starting in the mouth, and today's lower jaw, which is the rest of it, basically 80% already. Yesterday.
We do PRF in all of these spaces, similar to PRP.
And ozone, a lot of ozone. So basically cleaning it, we have to take out the root source of toxicity or chronic inflammation, and in this case the root canals, the titanium. Then to disinfect, we use ozone, we draw blood to PRP, because there's always the question, immediate implants, they don't work, ceramic anyways doesn't work. it will all fail. And why would you implant into like an infected area? If you understand the protocols around it, how to optimize overall health, which he's anyways doing and a professional in it, but then using tiny details during surgery and around surgery, it's possible, because then the ceramic implant will only come in after everything is clean, the socket is perfectly prepared, and it will stabilize the bone so that it doesn't collapse. So it's actually the perfect timing to do an immediate to keep bone height and width, and is a pain-free treatment. Otherwise you would come back 3 months from now to do an implant, which is then an extra surgery, right?
Yeah.
Makes no sense.
So started the healing journey now.
Yeah, that's the healing journey. I always say, let the healing begin. All right. How was it? Last day?
Last day?
Or last time? How was the last
Yeah.
one? 90 minutes?
It was good.
Was
I
okay?
feel good, yes.
Yeah, feel your whole body. So the cavitations are connected to the small intestine, heart meridian, whatever. Like some people have eczema from it, some are nervous from it, some have thyroid issues from it. So it's all a chronic inflammation. So we took that out, and it was again huge, fatty. Like I could place 4 membranes in this and 5 in this. It was about 1.5 cubic centimeters, or even bigger each side. And then one more root canal, which was on his large intestinal meridian. Large intestine is obviously a large intestine, digestion, microbiome, but also lung meridian. There's also the emotional tubes, and large intestine in Chinese medicine is also storing and dealing with emotions. So that's a good one. There was overpressed root filling material, cavitation in between the roots. I was able to place an immediate ceramic implant, so he now has 6 ceramic implants, right? No more cavitations, and now it's actually his job to take care of optimal health.
I'm just interested to see how I feel in the days and weeks to come. This was a lot. There was a lot that was removed. I think there's a lot of emotion around that, a lot of feeling around that. I think similar to, you know, I've talked to women that have had breast implants removed and, you know, things like that, where, you know, those had a potential to be carcinogenic and all kinds of things.
Yes.
Toxins around those, and just removing those can be emotional, you know, because it's part of your body, whether it's artificial or not. Like same with all these teeth, like this is my smile, this is my connection to the world. I speak all around the world, and having this stuff removed, there's like a lot of trauma, a lot of stories there, like a lot of pain, frustration, all kinds of things attached to this, you know, shame,
Yeah, of course.
and fear. And so like getting all this removed and then starting this process of, you know, the Sean 2.0, the healing, there's a lot to this, but I've devoted my life to, you know, healing myself and helping others on their healing journey.
Exactly, and this is how we co-elevate everything, because he is part of the mission that I'm on, like helping as many people as possible getting to optimal health. And we obviously have to have a clean, healthy physical body to reach all the other levels that we discussed. But yeah, every single tooth is connected to any sort of emotional trauma. Is always a trigger for your sympathetic or even your parasympathetic nervous system could be overtaxing. So it's just good to have, like, it was never a good idea to leave anything dead in your body. No medical department would do it, besides dentists, that just focus on biting. And you can bite on a root canal and on a titanium implant, no doubt about it. But for optimal health, we have to do it a little bit differently. I'm happy we can do this and share this info with you guys, and hopefully you spread it far to help at least one loved one on their journey.
Okay, so the last thing, Sean, is the X-ray downstairs. And then you're
Okay.
going to the optimal health lounge for the oxygen chamber.
Okay.
Yeah?
How long does it take for the
Implant.
no, I was gonna say the stitches, like
To dissolve like 6 to 8 weeks.
Okay.
Okay?
Okay. And how long should I kind of be careful and eat soft food?
To 4 months. 4 months you should.
All
like,
4 months?
Yeah, 4 months, because it needs like 3 to 6 months to heal everything. So we suggest always 4 months. After 4 months you come back and we check the implants, how hard, like how tight they are. That's why you should not eat like hard stuff, only soft things.
So basically, until I come back here, I have to eat soft food.
Yes.
Holy fuck.
Now you have to do the X-ray to see how they are inside in your bone.
Okay.
And check if everything is alright.
Okay.
Did it!
Okay.
It was very good.
There's all my removals.
Yeah.
There's my beautiful front smile right there. Oh my god.
We did quite a lot.
There's the gold. And he said that the gold and the titanium, this titanium and this gold makes a conductor in my mouth.
So this is Sean's panoramic before he came to see us. Both molars, top right, root canals, titanium implant here, a root canal here, like the front teeth, and then another one top left molar. These two cavitations, and lower right he had another root canal with overpressed filling, root filling material, and two cavitations. And this is the X-ray post-surgery. So I took out all the root canals and I was able to place immediate ceramic implants. There's no more cavitations, they're all gone. Even the titanium implant, which was a little bit, let's say, difficult, I was able to remove without hurting anything, placing a ceramic implant, putting a bit more bone graft out there, and try to pull up his gum tissue so that everything will look as pretty as possible and heals well. And then obviously immediate ceramic implants. So these white things are ceramic implants. 1, 2, 3, 4, 5, 6 he has. And when he comes back in about 4 months, so the osseointegration of ceramic implants, depending on nutrition and supplementation, needs about 4 months, ideally. I was only able to help his body heal. Now it's his turn by supporting it. So this is just parts of stuff we had to take out, like dead bone particles, root canals. This is just root filling material, and this doesn't look so healthy, I would say. I mean, it's dead body parts. This is how they look like. Then he had this titanium implant and a gold crown. And this is his right side, where we took out the teeth. There's no cuts. It's like the most minimal invasive thing. We just have that implant placed on gum line. Here's a bone graft and a bone graft, and then there's the PRP, the PRF membranes on top. See, this is how he presented with this extremely long tooth, because that titanium implant was way too far to the outside, so gum is gone. So I tried to at least get that gum, like, let's say 2 millimeters lower, so that he has not as long of a tooth. Luckily, he doesn't show, but I can show you temporary straight after surgery. Look at this. And straight after surgery, temporary, like this. So I pulled that gum a bit downwards, and then we'll leave it open to heal with that membranes here. Let's see where it gets to. But this one is too short. This one was too long. So maybe we can balance it out and later have this one until here and this one until here. It will be almost perfect. So let's see. Most important thing is that all these chronic health triggers are now gone and he can finally heal.
So I am a couple days post-surgery from these root canal replacements that I've done, working on the cavitations with Dr. Dom. And I thought it would make sense to do the facial treatment here at this clinic, the same clinic that I've done IV and hyperbaric chamber at. We're going to do microneedling, PRP, nucleotides, radio frequency, and a bunch of good stuff. I send this message with love, and it is a mission that I am on to help people, to save them from pain and suffering. And that's also Dr. Dom's mission too. And hopefully we can make an impact. Hopefully you have some questions. Hopefully you see that there is a better way. Hopefully you ask questions of your dentist, of your doctors, of why things are the way that they are currently and why we're not doing some of these better methods that we know are better for us. All right, love you guys.